over 100 VHTs across 4 districts of Budaka, Butebo, Mbale and Bukedi have received bicycles and megaphones at Salem Kolonyi Hospital from Salem Brotherhood, Uganda. According to Andrew Epenyu, the Deputy Director of Salem Brotherhood, Uganda, the handover of these bicycles will help a lot in community work, in primary health care, prevention and management of malnutrition in the 4 districts.
The children, especially the orphans. We graduated into managing infectious diseases and with a major component in primary health care. So since 1981, we have grown into a bigger project. We now have a hospital. We have a nurses training school. We still maintain the children's home, which is one of our core activities in supporting the vulnerable. In the background, fast forward, you can see that we have a new structure to be commissioned next year, which has the theater, very modern theater funded by German doctors, and the maternal child health unit, which supports the big arm of the reproductive health of the project. Today particularly, we are gathered here to witness a handover of bicycles that support our community arm. We do a lot of community work in primary health care. The component today we are covering is prevention and management of malnutrition in the communities of Bukedi, Mbale, Budaka and Butebo. So basically we have been around for some time.
Dr. Charles Wanzige Chimbugwe says the bicycles will ease movement to sensitizing the public through training and sensitization meetings, which will build the capacity of health workers to screen cases early and reach out for management.
Said about a third of people, of children under 5 are stunted. There's about 6%, according to the statistics, about 6% or in Uganda of children are wasted. So we are looking at how do we improve these statistics. And then of course we have very many children who are anemic, and also mothers who are pregnant who are also anemic. And these are the areas, these are targets, the target groups we want to reach out for the children under 5, because the under 5 component, these are children who are largely affected by this, because it affects their mental status, it affects other areas, but also we're also targeting the mothers who are pregnant, so that they know we train them how to feed during pregnancy, but how to feed their children after delivery.
According to Dr. Maximilian Kiefer, the German doctors and BMZ representative at Salem Hospital Kolonyi, the NGO is providing health around the world, and they hope to expand the project to entire eastern Uganda and also fight malnutrition by making strong partnerships.
Again, my name is Max Kiefer. I'm the representative of German doctors. We are a German NGO that focuses on providing health around the world. And we have been closely working together with Salem for the last years now. We have been implementing also the already mentioned pilot project that we are now hoping to, that we're now expanding with this project. The project is funded by the German Ministry for Development and Cooperation, and also by a small part of our own donations. So we're really looking forward to this project, which has just started now in June, to really take on and have the impact that already the pilot project had, but at a smaller scale. And now we are really happy that we have with Salem such a competent partner in really doing the work on the ground and fighting malnutrition here in eastern Uganda and the 4 districts.
Dr. Doreen Naiga, the project coordinator, said that during the pilot study done previously, the endlying evaluation showed the activities have brought a lot of changes, especially in the knowledge, attitude and practices of the people concerning nutrition.
Okay, thank you very much. So, first of all, this project managing malnutrition started as a pilot project that ran from 2022 to 2023. And when at the end of it all, and when they did the endline evaluation, they found that really the activities that were done during the project had really caused a lot of change, especially in the knowledge, in the attitudes and the practices of the people concerning nutrition. Yes, and so that pilot gave birth to this project that started in June this year. Yeah, we chose the districts of Bukedi, Mbale, Budaka and Butebu following a baseline study. We did a baseline study and we found that really there is a huge burden of malnutrition, whereby we found about a good number were malnourished and also almost a third of them were anemic. Yeah, and we also realized that there were very many knowledge gaps concerning good feeding and all that. Apart from the information that was given to us from the baseline, we also had experience as health workers in the facility, because we had very many children we were attending to suffering from malnutrition, and actually most of them were coming to us with severe acute malnutrition features. And so that caused us to really say let's with the collaboration of the German doctors and BMZ, let's go in to continue to manage and prevent malnutrition, because we all should know that malnutrition is not only a 1 day, 2 day, or a month problem. It can decide to be a generational problem. Like if, for example, if a child suffers from stuntedness, most likely that even when they deliver later on in their childbearing age, they will have a child with the same effects. And malnutrition affects the person's capability in cognition, that is their mental capacity. So you find that if at a younger age the child was disturbed because of stuntedness, or the mother, the child may not be able to achieve their potential. Yeah, so it's really a serious problem, and that is why we are here.
The beneficiaries expressed gratitude for having received the bicycles, which will ease transport to different parts of their villages.
Nnyo byonna bye mutukoledde okusingira ddala okutuwa transport nga magaali ge tugenda okutambuliramu mu bitundu byaffe, kubanga tubadde tubonaabona okutambula okugenda okuvisitinga abantu baffe abalwadde n'abaana baffe abo abali mu kyalo nga bali eyo balina endya embi, malnutrition, balwalira ddala, olabira ddala ng'omuzadde yakweka omwana mu nnyumba. Naye kati saaba nitugenda okutambula enju ku nju nga tusomesa abantu baffe baveeyo babeere nga bakola emirimu, babeere nga bayirabirira abaana baffe, okusingira ddala okusomesa abakyala babeere nga balima enva endiirwa okulaba nti baliisa abaana baffe ebintu emmere eri balancing diet, abaana baffe bakule nga balungi. Mwebale nnyo, mwebalire ddala, mwebale. Namataka anetivira mu Namanyonyi Health Center 3 ngaze kiamaza agenda okusomesa abakyala mu Namanyonyi Health Center 3.
Wa Hamia Mustafa Tegu omusawo mutendeke community health worker ngavira Namanyonyi ku Health Center eyokusatu. Nisanyuse nnyo okumpa entambula, mbadde nkola nga sirina ntambula, naye kakati nfunye amaanyi gamaanyi nnyo, ngenda kutambula mulyango ku mulyango, ndina essanyu ly'amaanyi nnyo, era nsimba omugenyi omukulu Dr. Day okoze omulimu gw'amaanyi nnyo gwa ntendo, era ngenda kukola omulimu n'omutima gumu. Alhamdulillahi rabbil alamin.
Lydia Akiding, reporting for Bukedi Times, here at Kolonyi Hospital, Mbale City.